Right now, tonight, while you're lying in bed thinking you're safe, thinking you're resting, thinking your body is healing itself, something could be happening inside your blood vessels that could change your life forever. And the terrifying part is, it has nothing to do with what you ate today, how much you exercised, or whether you remembered to take your medication. It has everything to do with the position your body is in while you sleep. A leading cardiologist is now warning that one specific sleeping position, a position that millions of people default to every single night without a second thought, is dramatically increasing the risk of stroke while you sleep. And most people who are at risk have absolutely no idea. They go to bed feeling fine, they fall asleep in the same position they've slept in for decades, and for some of them, that night becomes the night everything changes. So please, I am asking you, do not scroll past this. Do not click away. Give me the next few minutes of your attention because what you're about to hear could literally save your life. And when you're done listening, share this with every single person you care about because they need to hear this too. Now let's get into it because time matters and your health cannot wait. Let me start with something that most people have never been told by their doctor, and honestly, something that even many doctors don't emphasize enough during routine checkups. The position you sleep in affects far more than just your comfort and whether you wake up with a stiff neck. Your sleeping position directly influences your blood pressure, your blood flow, your heart rhythm, the oxygen levels in your brain, and the likelihood of blood clots forming in your vessels while you're unconscious and unable to do anything about it. When you understand this, when you truly grasp how much your sleeping position matters, you'll never go to bed the same way again. Dr. Michael Torres is a cardiologist and stroke specialist who has spent the last 25 years treating patients who've suffered strokes, and he spent the last decade specifically researching the connection between sleep position and cerebrovascular events. That's the medical term for strokes and other blood flow problems in the brain. Dr. Torres recently published findings that have gotten the attention of the entire medical community, and when he presents his research at conferences, the room goes silent. Because what he's found challenges something that most of us have taken for granted our entire lives. Dr. Torres says that sleeping flat on your back, the position that many people consider the most natural and comfortable way to sleep, is the single most dangerous sleeping position for people who are at risk of stroke. And when you consider that nearly 1 in 3 adults has at least one major risk factor for stroke, whether it's high blood pressure, high cholesterol, diabetes, atrial fibrillation, being overweight, or simply being over the age of 55, you begin to understand the scale of what we're talking about. We're not talking about a small group of people with rare conditions. We're talking about tens of millions of men and women who climb into bed every night, roll onto their backs, close their eyes, and unknowingly put themselves in danger. So why is sleeping on your back so dangerous? Let me explain what's happening inside your body when you lie flat on your back for hours at a time. Because once you understand the mechanics, it all makes perfect, frightening sense. When you lie flat on your back, gravity pulls everything downward toward the back of your body. Your tongue and the soft tissues in your throat relax and fall backward, which can partially or fully obstruct your airway. This is the primary mechanism behind obstructive sleep apnea, a condition that causes you to stop breathing repeatedly throughout the night. Now, sleep apnea might sound like it's just a snoring problem, just an annoyance for your partner, but cardiologists and stroke specialists know that it's far more serious than that. Every time you stop breathing during sleep, your oxygen levels drop. When your oxygen levels drop, your brain sends out an emergency signal that causes your heart rate to spike, your blood pressure to surge, and your blood vessels to constrict. This happens not once, not twice, but potentially dozens or even hundreds of times throughout the night in people with moderate to severe sleep apnea. Each one of those episodes is like a mini cardiovascular emergency happening inside your body while you sleep peacefully, unaware. Dr. Torres explains it this way. He says, imagine that every night someone came into your room and pinched your airway shut for 10 to 30 seconds at a time, over and over, all night long. Each time they did it, your heart would have to work harder, your blood pressure would shoot up, and the blood vessels in your brain would be subjected to sudden, violent changes in pressure. Now imagine this happening every single night for years or even decades. The cumulative damage to your cardiovascular system and your brain is staggering. And for many people, that damage eventually reaches a tipping point where one of those nighttime surges causes a blood vessel in the brain to burst or a clot to break free and block blood flow to a critical part of the brain. That's a stroke. And it happened while they were sleeping, in a position they never thought twice about. But sleep apnea is only one part of the equation. There's another reason why sleeping on your back increases stroke risk, and it has to do with blood flow dynamics in your neck and brain. When you lie flat, the blood returning from your brain to your heart has to work against a relatively flat gradient. This can cause blood to pool in the jugular veins, the large veins on either side of your neck that drain blood from your brain. When blood pools and moves slowly, it's more likely to form clots. These clots can then travel to the brain and cause an ischemic stroke, which is the most common type of stroke, and occurs when a blood vessel supplying blood to the brain becomes blocked. Research has shown that blood flow velocity in the jugular veins is significantly slower when a person is lying flat on their back compared to when they're lying on their side or when their head is slightly elevated. Slower blood flow means higher clot risk. Higher clot risk means higher stroke risk. It's that straightforward. There's also the issue of blood pressure regulation during back sleeping. When you lie flat, your heart is at the same level as your brain, and there's no gravitational assistance helping blood flow to or from the brain. For most healthy young people, this isn't a problem because their cardiovascular system compensates automatically. But for older adults, for people with stiff arteries, for people with high blood pressure or heart disease, this flat position can cause blood pressure in the brain to fluctuate in ways that put dangerous stress on already weakened blood vessels. The small arteries deep inside your brain, the ones that are most vulnerable to rupture, are subjected to pressure variations throughout the night that they were never designed to handle for extended periods. Over time, this can weaken those vessel walls to the point where they simply give way. And when a blood vessel inside your brain ruptures, that's a hemorrhagic stroke, which is often more severe and more deadly than an ischemic stroke. Now, let me talk about something that makes this even more concerning, and that's the fact that most people who sleep on their backs don't know they have sleep apnea. The estimates vary, but researchers believe that as many as 80% of moderate to severe sleep apnea cases in older adults are undiagnosed. 80%. That means the vast majority of people who have this condition, who are stopping breathing dozens of times every night, who are subjecting their hearts and brains to repeated stress and oxygen deprivation, have no idea it's happening. They might snore. They might feel tired during the day. They might wake up with a dry mouth or a headache. But they chalk it all up to aging, to stress, to not sleeping well, to 100 other explanations that seem perfectly reasonable. And all the while, every night they're lying on their backs, with their airways collapsing and their stroke risk climbing higher and higher. Dr. Patricia Holloway is a neurologist who specializes in stroke prevention, and she has been working alongside Dr. Torres to raise awareness about this issue. Dr. Holloway says that one of the most frustrating things about her work is seeing patients after a stroke and realizing that simple changes to their sleep habits could have prevented the event entirely. She told me about a patient named Walter, a 71-year-old retired teacher who had a stroke in the middle of the night. Walter's wife woke up around 3 in the morning and noticed that her husband was making strange sounds, almost like he was choking. She turned on the light and saw that the left side of his face was drooping, and he couldn't lift his left arm. She called emergency services immediately, and Walter was rushed to the hospital. He survived, but the stroke left him with permanent weakness on his left side and difficulty speaking clearly. When Dr. Holloway reviewed Walter's case, she found that he had been sleeping on his back for as long as he could remember. His wife confirmed that he snored heavily and sometimes seemed to stop breathing during the night, but they had never discussed it with a doctor because they assumed it was just snoring. Walter had never been tested for sleep apnea. He had high blood pressure that was being managed with medication, but nobody had ever talked to him about how his sleeping position might be affecting his cardiovascular health. Dr. Holloway told Walter and his wife that if they had known to change his sleeping position and get him tested for sleep apnea, there was a very real chance that his stroke could have been avoided entirely. She said the look on their faces when they heard that was something she will never forget, a mixture of sadness and frustration, and the unmistakable sting of knowing that something so devastating could have been prevented with information that nobody thought to share. Walter's story is heartbreaking, but it's also incredibly common. Dr. Holloway says she sees patients like Walter every single week. People who had risk factors that were known, who had symptoms that were visible, who had habits that were fixable, but who never received the guidance they needed to protect themselves during sleep. And the sleeping position issue is at the top of her list of things she wishes every patient knew about before it was too late. So, what should you be doing instead? What do cardiologists and stroke specialists recommend as the safest sleeping position for people who want to protect their brains and their hearts? The answer, according to the research and the doctors I've spoken with, is sleeping on your side, and specifically, sleeping on your left side. Side sleeping has been shown to have several significant advantages for cardiovascular health and stroke prevention. First, when you sleep on your side, your airway is far less likely to become obstructed. Your tongue and throat tissues fall to the side rather than backward, which means your breathing stays more open and consistent throughout the night. This dramatically reduces the frequency and severity of sleep apnea episodes, even in people who haven't been formally diagnosed with the condition. Second, side sleeping improves blood flow in the jugular veins. When you're on your side, gravity helps blood drain more efficiently from your brain back to your heart, which reduces pooling and lowers the risk of clot formation. Studies using specialized imaging have confirmed that jugular drainage is measurably better in side sleeping positions compared to back sleeping positions. Better drainage means better circulation. Better circulation means lower stroke risk. Third, sleeping on your left side specifically has been shown to benefit the heart itself. When you sleep on your left side, your heart is positioned in a way that allows it to pump blood more efficiently with less effort. The aorta, which is the main artery carrying blood from your heart to the rest of your body, curves to the left, and sleeping on your left side allows gravity to assist blood flow through the aorta rather than working against it. This reduces the workload on your heart during the night, which is particularly important for people with heart conditions, heart failure, or anyone whose cardiovascular system is already under strain. Now, I want to address something that I know many of you are thinking right now. You're thinking that you've tried sleeping on your side before and you always end up rolling onto your back during the night. That's an incredibly common concern, and doctors hear it all the time. The truth is that changing your sleep position after years or decades of sleeping a certain way is not easy. Your body has muscle memory, and it's going to want to return to the position it's used to. But there are strategies that can help, and they're simpler than you might think. One method that sleep specialists recommend is the tennis ball technique. You take a tennis ball and sew it into a pocket on the back of a t-shirt, or you place it in a sock and pin the sock to the back of your sleep shirt. When you roll onto your back during the night, the discomfort of the tennis ball against your spine gently nudges you back onto your side without fully waking you up. It sounds almost too simple, but studies have shown that this technique is surprisingly effective at reducing the amount of time people spend sleeping on their backs. Another approach is to use a body pillow or a specially designed side sleeping pillow. A full-length body pillow that you can hug while sleeping on your side provides support that makes the position more comfortable and makes it harder for your body to roll over. There are also wedge pillows designed to be placed behind your back that create a gentle slope preventing you from rolling into a fully flat back position. Elevating the head of your bed is another recommendation that cardiologists make, and it can be used in combination with side sleeping for maximum benefit. By raising the head of your bed by about 4 to 6 inches, using a wedge under your mattress or blocks under the bed frame legs, you create a slight incline that helps with blood drainage from the brain and reduces the gravitational forces that contribute to airway obstruction. This isn't about propping yourself up with a pile of pillows, which can actually create neck problems and doesn't provide a consistent incline. It's about adjusting the entire sleeping surface so that your head is slightly higher than your feet throughout the night. Dr. Torres also recommends that anyone over the age of 50, anyone with high blood pressure, anyone with a history of heart disease or stroke, and anyone whose partner has noticed that they snore heavily or stop breathing during sleep should talk to their doctor about getting a sleep study done. A sleep study, which can now often be done at home with a portable monitoring device rather than having to spend a night in a laboratory, can diagnose sleep apnea and determine its severity. If sleep apnea is found, there are effective treatments available, including CPAP machines that keep your airway open during sleep, and oral appliances that reposition your jaw to prevent obstruction. These treatments, combined with proper sleeping position, can dramatically reduce stroke risk. There's another factor related to nighttime stroke risk that I want to mention because it ties directly into sleeping position, and that's the issue of atrial fibrillation, commonly known as AFib. AFib is an irregular heart rhythm that affects millions of people, many of whom don't know they have it. AFib causes the heart to beat in an uncoordinated way, which allows blood to pool in the chambers of the heart and form clots. If one of those clots travels to the brain, it causes a stroke. AFib episodes are more common during sleep, and research has shown that sleeping position can influence the likelihood and duration of AFib episodes. Sleeping on your back has been associated with more frequent AFib episodes compared to side sleeping, possibly because of the changes in vagal nerve tone and autonomic nervous system activity that occur in different positions. For people with known or suspected AFib, sleeping position isn't just a comfort preference, it's a medical consideration that should be discussed with their cardiologist. Now, I want to come back to something I said at the beginning because it's the thing that keeps cardiologists like Dr. Torres up at night, which is ironic when you think about it. The thing that worries him most is not that this information is unknown. It's that it's not being communicated to the people who need it. He says the research is there, the evidence is there, the connection between sleeping position and stroke risk is well established in the medical literature, but somehow it hasn't become part of the standard conversation that doctors have with their patients. When was the last time your doctor asked you how you sleep? Not how many hours you get, but the actual physical position your body is in? For almost everyone, the answer is never. And that gap between what the research shows and what patients are being told is costing lives every single day. So here's what I need you to do, and I'm not just suggesting this. I'm asking you as someone who cares about your well-being to take these steps seriously. Tonight, when you go to bed, try sleeping on your side. If you normally sleep on your back, use a pillow behind you to help maintain the side position. Keep a body pillow nearby to hug for comfort and support. It might feel strange at first. You might not sleep as well the first night or even the first week. But you're retraining your body to sleep in a position that protects your brain and your heart. And that adjustment period is worth every minute of temporary discomfort. This week, call your doctor and ask about a sleep study, especially if you snore, if you're over 55, if you have high blood pressure, or if you have any history of heart problems. Don't be embarrassed about it. Don't minimize your symptoms. Tell your doctor that you want to know if you have sleep apnea, and you want to know what your options are for reducing your stroke risk during sleep. You are your own best advocate when it comes to your health, and asking questions is not a burden on your doctor. It's exactly what they're there for. And most importantly, share this information. Right now, today, with everyone you know. Share it with your spouse, with your parents, with your children, with your friends, with your neighbors, with anyone who goes to sleep at night, which is everyone. Because the person you share this with might be the person who changes their sleeping position tonight and avoids a stroke that was waiting for them in the darkness. You have the power to do that. You have the power to pass along a piece of information that could save someone's life. And all it costs you is a moment of your time. Strokes are one of the leading causes of death and disability in the world. They steal people's ability to speak, to move, to think clearly, to live independently. They tear families apart and leave survivors facing years of difficult rehabilitation. And while we can't prevent every stroke, we can prevent many of them. We can prevent the ones that are caused by fixable habits, by treatable conditions, by simple things like the position we sleep in. Dr. Torres says something at the end of every lecture he gives, and I want to share it with you, because it stays with people long after they leave the room. He says your body trusts you to take care of it, especially during the hours when it can't take care of itself. When you fall asleep, your body is placing its faith in you. It's trusting that you've put it in a safe position, that you've given it what it needs to make it through the night. Don't betray that trust by ignoring what the science tells us. Sleep on your side. Elevate your head. Get tested for sleep apnea. Talk to your doctor. These are small acts of care that honor the body that has carried you through every day of your life. Tonight, when you lie down and close your eyes, make a choice. Make a conscious decision to sleep in a way that protects you rather than endangers you. Your brain is counting on you. Your heart is counting on you. And the people who love you, the people who want to see you at the breakfast table every morning, for years and years to come, they're counting on you too. Sleep safe tonight. Sleep on your side. And wake up tomorrow knowing that you took one powerful step to protect the life you've worked so hard to build.